involved in a car or a motorcycle accident and you suffered a concussion and you want to learn how to maximize your compensation? Check out this short video to find out. Hey everybody, my name is Barry and this is the Lawful Channel. If you haven't figured it out yet, this is a great place to get short answers on the legal topics that affect our lives. If you haven't already, would you please subscribe to our channel? And if you have any questions or comments, reach out to me. If I can't help you, I'll find somebody who can. We're going to do things a little bit differently today. So our topic, concussions, is kind of a tricky one, and people ask me about it all the time. So I thought I'd bring in an attorney who has extensive experience dealing with concussions. His name is Jordan Powell, so I'm going to bring in him right now. Hey, Jordan.
Hi, Barry. Thanks for having me.
So Jordan's a partner with Passen Powell. Why don't you tell us a little bit about your firm?
Yeah, thank you, Barry. So we're a firm that exclusively does personal injury and medical malpractice cases. My partner and I have each been doing it for over 15 years. And we represent those that have been injured in predominantly automobile, motorcycle, trucking accidents, many of which, and we have a particular expertise in dealing with patients that have suffered from various types of brain injuries.
Yeah, that's the reason I really wanted to bring you on, because in my mind, you're my brain injury guy. Mm-hmm. So whenever I have a question about a concussion or a brain injury, I always reach out to Jordan. So let's start right there. So I think a lot of people know that they've suffered a concussion and they've suffered some symptoms and stuff, but they really have no idea what is a concussion. What does it really mean to them?
Yeah, the biggest thing about concussions is they're very tricky insofar as cases are concerned, because we know severe brain injuries when you have bleeding or you're actually needing brain surgery. A concussion is a different type of brain injury, but it is still absolutely 100% a brain injury. So typically concussions happen if there's a bump to the head or a jolt to the head. And it's important to remember with concussions, you don't necessarily have to hit your head. In a rear end auto accident or a side swipe auto accident where your head just gets shaken around, you can suffer a severe concussion.
So you can suffer, I get that question a lot because most of the comments are about rear end collisions in my channel. So if you suffer that whiplash motion, you can suffer a concussion from that.
Absolutely. Absolutely. Because what you have to remember is the brain is inside your skull. Okay. And what the brain is doing is it's floating in fluid. And so with a concussion or a whiplash type injury where you're jolted forwards and backwards, the brain inside that skull and fluid moves around. So the brain may bump the skull inside there, but your head didn't necessarily hit anything.
Okay. You know, so I was wondering, so it seems like in every car accident case that I see, and almost every comment I see on this channel, somebody says I got a concussion. Is it that common? I mean, do concussions happen in the majority of auto accidents?
It's very, very common. There's the statistics, I think, from the Centers for Disease Control say that there's about 3 million plus concussions per year. They happen in sporting events. They typically happen in automobile accidents. Because of that, shaking around, but they're very, very common. They vary in degrees and they vary in symptoms.
Yeah, I'm glad you brought that up, because one of the things that I've seen a lot in medical records is different degrees of concussions. So what are the degrees of concussions?
So the various degrees that we talk about when we talk about a concussion per se is there's 3 grades. We have grade 1, grade 2, and grade 3. Okay, grade 1 being the least severe, grade 3 being more severe. And the differentiation between those grades typically has to do with whether you've lost consciousness or not. So you can totally suffer a concussion, have debilitating effects from a concussion and lasting and permanent effects without even losing consciousness. But if you do lose consciousness, for instance, you don't remember what happened, or you wake up a few minutes later and there are all of a sudden paramedics at an accident scene, that's typically either a grade 2 or grade 3 concussion. And the effects are probably going to be more lasting and more severe.
Okay. You know what? I'm glad you brought that up, but stick around to the end of this video because we're going to talk about how you can take your diagnoses, a grade 2, grade 3, mild, medium, what have you, concussion, and maximize your compensation for it with the insurance company. So stick around for that. So we've talked a little bit and touched briefly on some of the symptoms of a concussion. Can you take us through some of the common symptoms that you see, and then maybe some of the less common ones?
Sure. The thing about concussions is the severity and the type of symptoms differ drastically from patient to patient and victim to victim. And a lot of them can be very similar to a more severe brain injury where we clearly have bleeding or you even need brain surgery. But they vary from headaches, a little bit of maybe dizziness, a light fog, you kind of feel out of sorts. You can actually have nausea. You can have vomiting from a concussion. You can have visual disturbances where you're not seeing clearly. Memory loss is also very common. And then some of the more, less common ones is something called tinnitus, which I've represented a number of automobile accident or motorcycle accident victims that have had, and it's continual ringing in the ears. It's ringing in the ears that doesn't go away. And that is it happens. And sometimes it becomes permanent. And so that's one that I've seen with concussions, but doesn't necessarily happen all the time.
Yeah, I actually remember that one case that I forwarded your way where the guy had tinnitus, and that is really compensable. I mean, if you're going to suffer ringing in your ears indefinitely, that is something you can really recover for.
Yeah, absolutely. Just think about ringing in your ears when you're trying to go to bed and it's quiet. It's just a constant buzzing that doesn't go away.
In general, how long do these, I mean, I know it applies to every person differently, but in general, how long do these symptoms tend to last with people?
Yeah, you said it. You hit the nail on the head. It applies differently to each person. Sometimes they can last for just days. And after a few days, the symptoms subside. The one thing that I do want to emphasize is you may leave an accident scene feeling absolutely fine. You may think nothing's wrong. And then hours later, you feel the symptoms come on. That's actually very typical. Sometimes it even takes a couple of days for the symptoms to come on. And the reason for that is the cause of the concussion is actually like swelling in your brain or microscopic, very, very small damage to your brain cells. And sometimes it takes a time for that to kind of manifest and fully recognize itself. So if you start feeling foggy or having headaches or nausea several days after an accident, that's not atypical. But with regard to your initial question of how long do the symptoms last, it totally varies. Sometimes they last for several months and go away. The tricky thing about concussions, and literature and physicians can't quite explain it, is sometimes the effects last forever. And typically, if we go for a period of after 3 to 4 months, maybe 5 months after the incident, you're still having symptoms, then we call it something called post-concussive syndrome. And that means that you're still having the symptoms and they more likely than not will remain to some degree forever.
You know, I tell people, I have a little saying that if it's not in the medical records, it doesn't exist to the insurance company. So, 6 months or 9 months later after an accident, if you're trying to claim compensation for concussion and you've gotten no treatment for it, it's pretty hard to do. So tell me a little bit about the treatment that somebody can get for a concussion. What kind of physician might somebody see and what might they do?
I think it's very, very important to have a record trail when it comes to cases of what you're doing, because insurance companies want to see that. As a lawyer representing a lot of brain injured victims, in particular with concussions, I know the symptoms are there whether you're seeing a doctor or not. But the insurance companies are skeptics and they want to see that documentation. So if you start having symptoms within hours of an accident where you were normally feeling fine, you need to go to the emergency room. You need to see your physician just to make sure that it's not something more worse that require, something more severe that requires immediate intervention. But then you need to continually see your doctor if the symptoms continue. Your doctor may refer you to a neurologist, a physician that specializes in brain and in the function of the brain. Your physician may even recommend that you see a psychologist or a neuropsychologist that can actually do brain testing that will evaluate whether you've sustained some type of permanent brain injury.
Okay, so I told the viewers earlier that we're going to answer a question for them that I'm sure that they're wondering about, and that is, how do you maximize compensation when you suffer a concussion with an insurance company? Obviously, getting the treatment that you need is one of the main ways to do that. Do you have any other tips with regard to that?
Yeah, that would be the main tip for the patient, is to get the treatment they need, continually follow up. If you're not getting better, seek out different recommendations. From the lawyer perspective, what I think is very important, what I found in maximizing damages, is get that corroborating or additional evidence. So we've got the medical records, but then we need evidence, either statements or sworn testimony from independent witnesses like coaches, friends, co-workers, therapists that either knew you before the accident and then can explain the stark contrast after the accident. So that way you have this corroborating evidence, and it's not just you saying what's going on. It's independent witnesses saying, well, this is what I've observed going on.
Okay. Yeah, that's a really great tip for everybody. The one last question for you is that everybody wants to know the answer to this question: how much is my case worth? And so, does it just vary by every single case is different, or would you have an answer to that?
I don't. I can tell you the range of pure concussion cases that I've settled over the years. They range from cases that have settled for $20,000 all the way up to over $2 million. So obviously, not every case is going to be worth $2 million, and not every case is going to be worth $20,000. There's a lot of variables that play into concussions. It requires that diligence by the patient of seeking out the treatment. It requires diligence of an attorney of getting that corroborating evidence and the proper testing in place. And it requires diligence of convincing the insurance company that this is a real thing, because with concussions, they're kind of like a misnomer. People call them mild brain injuries. To me, there's no such thing as a mild brain injury. A brain injury is a brain injury. It just depends how it affects you. With concussions, the trick is you don't have an X-ray that shows a broken bone that you can show an insurance adjuster or a jury. Because MRIs and CT scans, the testing they do for brain injuries, typically doesn't show bleeding from concussions because the damage is so microscopic. But because the damage is microscopic, that certainly doesn't mean you don't have severe consequences and severe injuries. The injuries are actually quite severe, or can be quite severe. So you need to try to provide all the pieces of the puzzle to the insurance companies so they truly evaluate and understand the magnitude of an injury.
Okay. Well, this has been great. Jordan, I want to thank you a ton for your time today. Valuable information for the people who watch the videos on this channel. So I'm going to switch over here back to me real quick. Just want to say thank you for watching this short video on concussions. If you haven't already, would you please subscribe to our channel? And if you have any questions or comments for Jordan or I, put it in the comments section below. If I can't help you or Jordan can't help you, we're going to find somebody who can. I just wanted to let you know we'll be releasing another video every Tuesday. And every Friday I go live with my top 5 legal questions of the week. So make sure you check that as well. Thanks a lot for checking out this video, and we'll see you next time.